A blessed day. My name is Micaela Garcia Bertolo, a trainee of TESTA in Contact Tracing Level 2. In this video, I will be demonstrating how to safely put on and take off personal protective equipment, which we also call doning and doffing. I will also demonstrate how to take the patient's vital signs and apply basic first aid. First, we have to identify and gather appropriate or proper PPE to don. What we'll need is a lab or an isolation gown, face shield or goggles, respirator or face mask, and gloves. Before donning, we have to perform hand hygiene by using alcohol, hand sanitizer, or wash hands with soap and water for at least 20 seconds following proper hand washing method. After sanitizing hands, you have to put on the isolation or lab gown. Do tie all ties with the assistance of your fellow contact tracer trainee or partner. Next, put on a face mask. Extend the face mask under your chin, protecting both your mouth and nose. Next is you have to put on a face shield or goggles. And the last step is to put on the gloves. Extend the gloves covering the ends of the lab gown. In taking vital signs, you have to prepare the patient or client. Advise the patient or client to relax by allowing 5 minutes rest before the first reading.
Good morning, sir. So, my name is Micaela Bartolo. I am a staff at the health department. So, I will be taking your vital signs later on, but I will give you 5 minutes to relax po. Is that okay with you, sir? Okay, thank you po.
Inform the patient or client to sit upright with their upper arm positioned so it is level with their heart and feet flat on the floor. Remove excess clothing that might interfere with the BP cuff or constrict blood flow in the arm. Be sure that you and the patient refrain from talking during the first feeding.
Meron po ba kayong nararamdamang sakit sa katawan nyo na i-rate nyo po from 1 to 10? May nararamdaman po ba kayong sakit? Wala. So, 0 po. 0. Okay po.
First is you have to get the patient or client's blood pressure. After getting the blood pressure of the client or patient, get the patient or client's oxygen saturation and heart rate using pulse oximeter. Pulse oximeter is a small, clip-like device that attaches to a body part, like toes or an earlobe. It's most commonly put on a finger, and it is a painless test that measures your oxygen saturation level or the oxygen levels in your blood.
So, next, sir, yung gagawin po natin is i-check po natin yung inyong pong oxygen saturation. So, try nyo po lang next finger na.
Last, get the patient or client's body temperature using a digital thermometer.
Check mo lang yung level. Oximeter 7. Thank you po, sir. Thank you so much po.
Assess and record the reading. After the test, recommend appropriate response to client or patient based on the reading. Now we will move on applying basic first aid. What is first aid? First aid refers to the emergency or immediate care you should provide when a person is injured or ill until full medical treatment is available. In the next video, I will be demonstrating how to apply basic first aid given with the following scenarios. Patient is having difficulty in breathing. First, advise the patient to Number 1, sitting position. Sit on a chair in a comfortable position. Keep feet on the floor. Lean chest forward a little. Rest elbows on knees. Place chin in the hands. Relax neck and shoulder. In a standing position, flatten back on the wall. Stand straight and slowly breathe in and out until normal breathing regains.
Ayos lang yung nasa wall. Yan. Pause. Flatten. Stand straight. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale.
In a lying position, lay down the patient. Position on sideward ensuring back is in straight position. Elevate patient's head. Place pillows in between knees. Let patient do breathing exercise for about 1 to 2 minutes until normal breathing is restored. What if patient is suicidal? What you need to do is calm the patient, give encouraging words, seek assistance or call for immediate help.
Pero you have to calm down. Andito kami to assist you. So, you are so beautiful. You are blessed and loved. Sometimes, the world, yung nakikita natin, hindi nakapabor sa gusto natin mangyari. But always remember that everything happens for a reason. And if it's for you, it will find its way. So, you have to calm down. So now we're going to call the 911 to seek assistance. So please, can anybody call 911? Please call 911.
Checking the patient airways, you have to ask the patient how okay he or she is. Tap shoulder, move to straighten head and body. Tilt head and chin. Open and check mouth for any obstacle hindering airways. In checking the patient's breathing, you have to check the pulse. Closely place ear on the patient's nose or mouth to feel breath. Observe rising and falling of the chest. Checking the patient's circulation, perform 10 to 15 chest compression. Continue until patient regains consciousness or medics arrived. And don't forget to recommend appropriate response to patient's condition. In dosing, remove and discard your gloves. Do glove-in-glove technique by pinching the outside of the glove near the wrist. Peel downwards, pulling the glove inside out. With your ungloved hand, slide your finger under the wrist of your remaining glove. Again, peel downwards, turning the glove inside out. Next, doff off your lab or isolation gown. Untie all ties, avoiding forceful movement. Reach up to the shoulders and carefully pull or roll the gown down and away from the body. After disposing the used gown, you must perform a hand hygiene again using alcohol, hand sanitizer, or washing your hands according or following the proper hand washing method. Next is you remove the face shield or goggles. Carefully grab the strap, pulling upwards and away from your head. Do not touch the front of the face shield or goggles. Next is you remove and discard the face mask. Carefully untie the straps or unhook them from your ears and pull the mask from your face without touching the front of the mask. After doing that, you have to perform hand hygiene again by using alcohol, hand sanitizer, or wash hands with soap and water for at least 20 seconds following proper hand washing method.